do you mind introducing yourself, your name, your title, and the organization that you represent?
Yeah, absolutely. So hi, Sam. Good to
Mhm.
be here. My name is Zina Manji. I'm head of regulatory affairs North America for Ellume, which is a digital diagnostic company. And I have 23 years of experience in regulatory affairs.
Wow.
And what really is my focus and has been my focus for the past several years is disruptive innovation.
Wow, that's fantastic. Welcome, Zina. So
Thank
is
you.
this your first HITLAB Summit? Have you been to these before?
I've been to the virtual summits before, and
Okay.
then I attended the last one in November
Mhm.
in person, and then it was
Mhm.
partially virtual. So this
Right.
is actually my first 3-day in-person event.
Wow. That's wonderful. So what do you think of it so far? How does it feel to be around so many people talking about digital health? What do you get out of these summits, and what do you think other people get out of them?
Yeah, I think HITLAB is such an approachable platform,
Mhm.
and it attracts diversity
Mhm.
of experience, whether it's academia
Right.
or industry or independent professionals who are working in the area,
Yeah.
investor relations,
Mhm.
venture capitalists. So you get an opportunity to really get a broad view of
Mhm.
what digital health is all about.
Right.
And when you're in person, it has a whole different vibe because you can
Definitely.
really have a lot of sidebar discussions.
Yeah.
The networking events are really helpful to
Mhm.
promote connectivity.
Yeah.
So being in regulatory affairs, it's important to me to
Mhm.
understand what's going on in the industry,
Yeah.
and what better way to do that to actually
Mhm.
be participating.
Yeah, absolutely. Couldn't agree more. That's wonderful. So, in your 23 years of experience, you've seen pretty much everything. So, I wanted to know from when you started to now, today in 2023, what are some major things that have changed for the better, and where do you see it going in the future?
Yeah, it's a great question. And during the event, there's
Hmm.
been a lot of discussion about predictions.
Yeah.
So speaking from my standpoint
Hmm.
and what I've seen through the years, I saw a real dramatic shift, probably in about 2018,
Hmm.
which is when I really started to get into disruptive
Right.
innovation. And that is the acceptance of digital health
Hmm.
coming through FDA.
Yeah.
You had products that were getting onto the market with FDA's endorsement through allowing and permitting marketing of these products. And what digital health actually does
Hmm.
is it gives access to healthcare
Yeah.
in a way that was not possible before.
Hmm.
So you have access now to digital therapeutics, wearables take on a whole different meaning.
Hmm.
And in my view, it's looking at what is the outcome that the wearables and the technology and medical devices are actually delivering.
Hmm.
And I think with digital health, it really changes the landscape of traditionally, from a regulatory perspective, you're looking at prescription, non-prescription, you're
Right.
really looking at the specific boxes that you fit in and
Hmm.
what the products fit in terms of should they be offered by a doctor
Hmm.
or can it be used completely over the counter. Now, of course, that still exists,
Right.
but what digital health does is it blurs the patient consumer
Hmm.
category. So if
Sure.
you take it a level lower than prescription and OTC
Hmm.
and talk about patient consumer, those lines are blurred.
Yeah.
And everything with digital health is shifted towards in-home, away from the
Hmm.
clinic, away from the hospital. So
Right.
you have an opportunity to actually look at self-care in a whole
Yeah.
different way and really meet the patient, meet consumers where they are,
Hmm.
and intercept at appropriate time points, and more going forward in real time
Yeah.
to really make a difference in their status of their health.
Yeah, absolutely. Those are some great points. So I wanted to follow up. Do you think digital health improves accessibility in healthcare, or do you think it adds another layer of complexity and another set of hurdles that people have to jump over?
Yeah, that's a great question. I think it depends on how the product or tool is actually developed. You can develop something very complex and difficult to use.
Right.
And you might even get regulatory clearance and permission to market it, to come to market that way.
Right.
It's possible, as long as you've proven that it's usable. But is it easily usable?
Yeah.
Will patients or consumers, that call them individuals or users, could be a healthcare professional that's a user. So will the user individuals actually engage with it? Just because you have regulatory permission doesn't mean the users are actually going to engage with the product.
Absolutely.
So I think what's really important as developers, that you look at how easy it is to use, how easy are the tools to engage. What is the workflow of a patient or consumer at home? You know, what do they go through in their journey of healthcare when they're trying to use the product? Is it helping? Is it frictionless? Or is it causing more friction and actually not that helpful? Same with healthcare workers. Is it helping the workflow, or is it just giving additional burden? This will depend on how it was designed, and ultimately, can you actually drive to the outcomes that were intended?
Yeah.
It's really based on that user experience.
Yeah. So in regulatory affairs, how do you kind of ensure this frictionless process, and that these products are the ones that are being promoted to consumers and users, and that they're getting access to the best digital care?
Yeah, so traditional regulatory affairs role would be more as an advisor. But what I try to drive, and what my experience has drived, and what I've been trained to do, is to be a business partner.
Okay.
So that's how I try to bring it forward, is in the conversations. I encourage engaging regulatory early in the process, so that we can have a 360 discussion on the design and the purpose of the test, purpose of the product. What is the intended use?
Right.
Get that clear up front. Now, how can we get that easily to market and easily usable? Because if people aren't engaging with it, ultimately, you're not going to drive the outcome. So I think also, you know, a regulatory affairs application, you're telling a story. You're telling a narrative.
Yeah.
You know, once upon a time, there was a molecule. There was, you know, a digital tool, a medical device. And these were all the things created to help deliver the outcome that you're looking for. So you tell the story about what is the intended use and how that intended use is being delivered. The more that you can assure usability and reproducibility, reliability, understandability of the product, the more it will give regulators a better sense of measuring the risk-benefit ratio.
Yeah.
And actually helping to bring the product to market as you intend to do.
Right. Yeah, absolutely. So I understand that you are speaking later today without giving away too much. I was
Yes.
wondering if you could give a little bit of a summary of what you're going to be speaking about and what you hope the audience takes away from it.
Yeah, so it's great you asked me about regulatory affairs, because I am speaking about innovation and innovation mindset given by a regulatory affairs professional perspective. I'm not talking about regulatory affairs in a technical way, but more about what you were just saying. How do you have those conversations to bring forward something that's disruptive and innovative? How do you ensure that you are sticking to the problem that you're trying to solve, and you don't get scope creep and now you're ending up somewhere else than what you intended?
Yeah.
So some high-level themes and concepts related to that.
Yeah, absolutely. That's a great and unique perspective that I'm sure everyone will enjoy so much. Well, Zina, thank you so much for answering all my questions and for chatting with me today.
Thank you,
I really
Sam.
appreciate it. I loved all your responses. They were super insightful and interesting. So thank you.
My pleasure.
Yeah.
Thank you so much.
Yeah, of course.